I'm Michael Haas. I was born in Fort Wayne, Indiana in 1942. Met my wife in '68 and then joined the Marine Corps. There were 10 of us on our set of orders. There are only 2 of us left. The other 8 were killed before the full year of our overseas tour was complete in Vietnam. Got out of the Marine Corps, and I had a brother who was a sheriff, LA County Sheriff, so I applied at Cypress Police Department and at LAPD and with the LA County Sheriff's Department. And the first one to hire me and put me to work and pay me was Cypress. Had a minor heart attack on the job in 1982.
He's a gentleman that has many cardiovascular risk factors. My name is Katrine Ziroff. I specialize in treatment of cardiovascular diseases, and I'm also an interventional cardiologist. When he came in to see his primary physician complaining of new onset of chest pain, he very astutely referred him to have a heart stress test. So the stress test showed that there was a very large territory of heart muscle that was in jeopardy, meaning that there wasn't enough blood supply to that part of the muscle. Those are the patients that are at very high risk for sudden cardiac death.
So I was in bad shape, just didn't know it.
And that would be why he was referred to Dr. Gasseri to have surgery to open up the blockages.
I'm Ali Gasseri. I'm a cardiothoracic and vascular surgeon. Because we found out that he had severe triple vessel coronary disease, including severe left main disease, he would have been at a very high risk of having a major heart attack and even dropping dead at home.
Without that professional staff, I wouldn't have made it.
My name is Yoli, well, Yolanda, but a lot of people call me Yoli. I prefer Yoli. I currently volunteer at PIH Health. I was with a coworker. We were having lunch, and when we were going to leave, I tried getting up and I couldn't. I collapsed, I fell on my side, and I busted my forehead open. So I was gushing out blood, so it was everywhere. I couldn't move. They flipped me over to my back because I did fall on my stomach. They asked me if I could get up. I couldn't get up. I couldn't move.
I'm Eduardo Tovar. I'm a heart surgeon and a chest surgeon as well. For someone her age, that was devastating. Eventually, we figured out that she had had a heart attack and that she had a clot within the larger chamber of the heart. And that went to her brain, and she sustained a stroke.
I still wasn't processing anything, but I kept telling myself, you're okay, you're fine. It's just a dream. It'll be over soon. My older sister, she put her hand on my arm, and I couldn't feel anything. But me seeing her put her hand on my arm and not feel it, that's what made me break down.
She had to come to the hospital because of the stroke. And we wanted to know what had happened to her. So she had a study, and the study demonstrated that she had an anomalous left coronary artery that was connected to the wrong vessel. We waited for the neurologist to determine when the timing for the operation was, and performed a very complex surgery. Likely, the only solution, had we waited longer, would have been a heart transplant.
So if he hadn't found that problem with the equipment that they do have now, I wouldn't be here. He is my angel on earth.
Contributions to cardiothoracic and cardiology are of great importance because it allows us to use newer technology, decreasing the risk of the patient in which this technology is utilized?
We're fortunate to be part of PIH Health, which has 3 different hospitals in 3 different areas of town. And as a result, we can coordinate care for a wide range of patients in these areas.
And these funds that support the cardiovascular program allow us to have this comprehensive program across all sites.
We need to thank everyone that contributes to our cause.
Benefactors and donors who can continuously donate to the program so that we keep up with that legacy, especially in terms of research, in terms of innovation, in terms of being in the cutting edge of advanced technology and advanced care for our patients.
So now our patients can have the specialty care with the continuity of care, with being taken care of by physicians that see them throughout the spectrum of their disease.
The fundraisers and the donors that keep this program functioning, they're the reason that my life was saved.